now I'm going to talk about the humerus, which is the bone of the upper arm, of the brachial region of the arm. So here's the humerus, and so you need to orient yourself first with this particular long bone. This rounded portion up here, this rounded epiphysis, okay, this expanded region of the bone. This is the proximal region of the bone. This is the head of the humerus, somewhat spherical, and this is going to fit into the glenoid cavity of the scapula. So this is the head of the humerus, okay? Now, this end where you can see multiple processes, rounded processes, this is the distal end of the humerus and would help make up the elbow joint. Okay. Now let's talk about how you can tell anterior versus posterior of the bone. All right, so here, this is the anterior side of the bone, and I know that because of this small little depression called the coronoid fossa. This is the coronoid fossa, small depression. So this is the anterior part of the bone. If I flip it over, you'll notice that there is a much larger depression that's called the Olecranon Fossa. So a large Olecranon Fossa at the distal end of the bone. This is the posterior side of the humerus. Olecranon Fossa, posterior, Coronoid Fossa, anterior. Okay? This is proximal, this is distal. Now let's talk about how you can determine right or left. First, you want to make sure you know anterior and posterior, and remember everything is referenced to anatomical position. That's my kitty cat.
That's the kitty cat.
Everything is in reference to anatomical position. So this is the anterior of the bone, and I know that because I see the coronoid fossas, the small depression. And the head, look at the head of the humerus and how it turns in. So this is the right. This is the left. Because the head of the humerus has to turn in towards the midline, towards the body, to fit into the glenoid cavity of the scapula. So this is the right, this is the left. All right, so let's talk about some other structures that you need to be able to identify. Up here, on the proximal end of the bone where you see the head of the humerus, you'll notice, I'm going to go ahead and flip it around this way. Okay, you'll notice that there are these rough processes. This is the greater tubercle, and this is the lesser tubercle. Anytime you use the terms greater and lesser, it's usually referring to size and or greater being superior and lesser being inferior. So if you look, this rough kind of rounded projection is a little bit higher than this one. So this is the greater tubercle, this is the lesser tubercle, and in between the two, you see the intertubercular groove. Okay? The greater tubercle and the lesser tubercle serve as attachment sites for muscles that move the upper arm and shoulder. The intertubercular groove serves, this is where the tendon of the biceps brachii leads to the shoulder. The biceps brachii being the muscle that will flex the arm at the elbow. So this is where the tendon of the biceps brachii leads to the shoulder. This rounded, this rough, I said not necessarily rounded, I'm sorry, this rough area right here, this is the deltoid tuberosity, and this is where the deltoid muscle attaches to the diaphysis of the humerus, diaphysis meaning the shaft of the bone. Okay, so this is the deltoid tuberosity where the deltoid muscle attaches, and the deltoid muscle raises the upper arm horizontally. Down towards, let's go to the distal end of the humerus. I've already pointed out this small depression is the coronoid fossa. The coronoid fossa articulates with the coronoid process of the ulna. And right below the coronoid fossa, you'll see this region right here. This is called the trochlea. The trochlea is going to articulate with the trochlear notch of the ulna. This rounded, more rounded rounded process, Okay, this is on the lateral side of the bone. This is the capitulum, and the capitulum is going to articulate with the head of the radius. Okay, head of the radius. So let me go over those again. Coronoid fossa, directly below, this is the trochlea, and lateral to the trochlea, this is the capitulum. Okay. Now this region, since the capitulum is on the lateral side, the trochlea is more medial. This region right here, this projection, this somewhat rounded projection, is called the medial epicondyle. Okay. And this region that kind of sticks out right here, this would be the lateral epicondyle. Okay. The medial epicondyle, okay, on the trochlear side, and the lateral epicondyle on the capitulum side. These serve as attachment sites for the ligaments that make up the elbow joint. Okay, it's attachment sites for the ligaments. Turn the bone over to the posterior side. This is this large indentation. This is the Olecranon Fossa, and it's going to articulate with the Olecranon process of the ulna. Okay? All right. And that's it for the humerus.